Okay, so we are completing the performance evaluation today of arterial puncture, which is page 33 in your performance evaluation binder. And today I have Sade helping me to demonstrate this evaluation. So for number one, I have already gone and confirmed the order in the chart and verified the indications for why the blood gas is needed. I've also looked in the chart to make sure there is no history of bleeding disorders or that the patient is not on blood thinners. If there were to be any of use of blood thinners or history of bleeding, I would want to make sure I would then compress the artery afterwards for a longer period of time to make sure that it clots. I'm also going to make sure that whatever changes have possibly occurred with the patient with oxygen has not, or any type of therapy has not, has been done 20 to 30 minutes ago, and that confirms a steady state. So once I have got to that point, I'm getting my supplies. So we have gloves, we have our ABG syringe. It is actually a pre-heparinized syringe. We have the needle and the capping device, all part of that. I have the alcohol prep pad is in here as well to clean. I have the sterile gauze. The patient label is in here, and I would have that already filled out, ready to go to put on the syringe when we're done. I have a biohazard container to carry it into the ABG machine. I do not have any ice because I will plan on running the gas as soon as we're done and not taking any time. I don't have towels, but towels are useful for helping to move the wrist in a direction that I want to. So you can put it under here to hyperextend the wrist. I'm not going to use that today. All right, so then after I have all of my stuff, I also have the capping device as well that we'll use. I'm going to then wash my hands and I'm going to don gloves. I use smaller gloves than usual because I want them to be very, very tight. It makes it easier to palpate the radial artery. So then you go into your patient, with your patient, identify. Can you please tell me your name and date of birth?
Sade Spakes, and my birthday is October 16th, 1991.
Okay, great. Well, my name is Lindsay Fox, and I am the respiratory therapist today. And today we actually have to draw some blood from your wrist, and this is going to tell us about how you're doing with your breathing, okay? So it's really important to stay still so that we only have to do it one shot. Before I do that, which hand do you write with?
All right.
Then let's look at your left hand here, and we're going to do what's called an Allen's test. I just want to see that you have good circulation. So just close and open and close and open one more time, and then I'm going to release the ulnar artery, and I see that your hand flushed pink very quickly, so that tells me you have good circulation. So I'm going to use this wrist.
Okay.
So now we're going to move to the simulator. I don't have to stick Sade today, and she's actually going to pump the bulb for me so that I have a pulse. So if you can go ahead and do that, I'm going to palpate my pulse and feel for where it's at. Once I've noticed where I'm going to stick, that's when I would clean that area. Please do not actually use the alcohol pad to clean, just simulate it like this, because if you use the real alcohol swab, we can hurt or damage the skin. But at least simulate it so you note that you did clean that area once you've kind of noticed where you're going to stick at. So you have everything ready now. I'm going to keep pumping here so I can make sure I have that again. There we go. Okay, so I'm going to make sure that the bevel is up, and then I'm going to go at a 40-degree angle. And Miss Sade, this is going to be a little poke here. Hold really still for me. Big poke. And I got it. I'm going to let it go in a little bit. You don't have to do much. Okay, stop. I'm ready to withdraw, so I'm going to have my sterile gauze ready. Okay, I'm going to use my capping device. So I can cap it. And I'm going to hold here for at least 5 minutes, making sure that I look at it after I'm done to make sure it's not still bleeding. Once it stops bleeding, you can be done. You don't even have to put a Band-Aid on it, in all honesty, because if it's stopped bleeding, then there's no need for a Band-Aid. And if it hasn't stopped bleeding, you need to keep putting pressure. Putting a Band-Aid on it is probably not the best way to go about it. All right, so I have my blood gas. It doesn't take much. About 1 ml is a recommended value. Take off your capping, your needle, and you would place this in your biohazard needle stick container. Put the cap on, and you're gonna kind of do this to get the bubbles all at the top. Push it. There goes some blood. My bad. Push it a little bit, then you're gonna rock it and roll it. This kind of mixes it up with that heparin, so it's all nice and good. You put that label on it, so you know where it came from. Put it in its bag, and then you would take it to the AEG machine to run it. Everything else, like I said, your needle goes into the sharps box. Everything else can go in the trash. You would document the procedure. You would want to make sure you noted where that actually came from, which artery, right or left radial artery, the status of the patient. All of that can be documented on that patient label. And then you would want to go back later and just make sure that you looked at the site and checked for a hematoma and adequacy of circulation. And what that just means is I would look at her hand, and again, just note that she has good color in her hand. If it was pale or pallid color, then you would be worried that maybe she wasn't getting good circulation. And that would be it. And of course, you would thank her when you were done, because that wasn't a very fun experience. So that is it, and good luck, and thank you so much.
Thank you.